What is a keloid? It is a type of excessive pathologic scar seen on the skin. It occurs when the fibroblast excessively proliferates to cause increased collagen and extracellular matrix deposition. Whenever there is injury to the skin, it tries to heal by different stages of wound healing. Deviation in any of the phases of wound healing can result in excessive scar and ultimately forms a keloid. So, what are the characteristics of a keloid? Keloids form when excessive scar tissue is deposited within and beyond the boundaries of the wound. It could be pruritic, that is, it may cause itching, it could be painful, or psychologically unbearable. It is caused by trauma to the skin in conditions like acne, body piercing, burns, lacerations, and surgical wound. Keloid typically is a growth of dense fibrous tissue. It grows beyond the boundaries of the original wound. It is raised and firm, pruritic, and painful. It does not regress spontaneously and shows as hyperpigmented area in dark-skinned individuals. The common site for appearance are chest, shoulder, upper back, posterior neck, and earlobes. The pathogenesis of keloid is that when there is an imbalance between the collagen formation and degradation, it results in keloid formation. So there is decreased degradation of collagen and increased synthesis of collagen and extracellular matrix. Increased collagen and extracellular matrix secretion occurs due to overactivation of the keloid fibroblast, which is in response to overexpression of inflammatory mediators like the transforming growth factor beta. This results in increased TIMPs and decreased matrix metalloprotein production, which ultimately causes reduced collagen degradation. This, along with increased collagen production, leads to keloid formation. Treatment options for keloid are occlusal dressings, where silicone gel sheetings are used. Mode of action. It acts by hydration and occlusion of the wound bed, which helps in moisture retention and prevents dehydration of the stratum corneum, which limits activation of fibroblast and subsequent collagen production. The period of use is 12 hours per day for at least 12 months. Compressive therapy is used along with surgical excision to prevent recurrence of keloids. Mode of action. Mechanoreceptor-induced apoptosis of the cells in the extracellular matrix or pressure-induced ischemia. This results in altered fibroblastic activity and promotes collagen degradation. The types are elastic wrap bandages, custom pressure ear molds, earrings, and magnets. It is used for at least 12 hours per day for 6 months at a pressure of at least 24 mm of Hg. Intralesional steroids are the first line of treatment for keloids due to its efficiency and accessibility. It suppresses wound inflammation mediators, reduces fibroblast growth, increases collagen degradation, reduces expression of transforming growth factor beta, and causes fibroblast apoptosis. Triamcinolone injection is commonly used. Topical application of imiquimod 5% cream. It is an additional therapy for keloid after surgical excision. It limits fibroblast production of collagen via the increased local concentrations of interferon alpha. This reduces the fibroblast activity, reduces the glycosaminoglycans content, and increases collagenase levels, causing collagen breakdown. It should be used daily as a topical application for 20 to 24 weeks. Topical mitomycin C. It is an anti-tumor antibiotic isolated from streptomycin caspitosus. It has an anti-fibroblastic effect without inhibiting epithelialization, cross-links DNA and inhibits cell proliferation. It is applied as a post-excision application of topical mitomycin C for 5 minutes post-operatively up to 6 months. Intralesional and topical 5-FU, also called as 5-fluorouracil. It's a chemotherapeutic agent which causes disruption of the DNA replication and cellular proliferation, which results in reduced fibroblast growth, induced fibroblast apoptosis, and decreased tumor necrosis factor beta driven collagen synthesis. It is applied as a topical gel, tattooing, and dermojet intralesion injection. Surgical techniques involve simple surgical excision plus surgical reconstruction. This helps in reduced rates of recurrence. Following complete excision, primary wound closure can be achieved by transpositional flaps and double cross skin flaps. Alternative to primary closures can be full thickness skin grafts. Interferons are cytokines with antifibrotic and antiproliferative functions. Interferon alpha and interferon gamma suppresses collagen synthesis and scar contraction by the fibroblasts. It is applied as an injection either 0.1 mg or 0.01 mg at a frequency of 1 to 3 times per week for 3 to 10 weeks. Bleomycin. It is a glycopeptide isolated from Streptomyces verticillus. It acts to cleave single-stranded and double-stranded DNA and induces cell apoptosis. This results in suppressed collagen synthesis by the dermal fibroblast, increased collagen turnover, and decreased levels of lysyl oxidase required for collagen maturation. It is applied as a tattoo or dermojet intralesional injection. Cryotherapy is also called as freezing therapy, which is used to reduce scar volume and recurrence. The temperature of keloid scar is lowered below -22 degrees Celsius. It works by vascular damage, cell anoxia, cryonecrosis, and coagulative necrosis. It reduces the myofibroblast, reduces mast cells, and reduces production of transforming growth factor beta. It is applied as a spray, contact, and intralesional therapy. Radiation therapy can be used as an adjunct therapy to surgical excision. It reduces fibroblast cell growth and decreases its proliferation. It can be used as an external or internal form. External form includes X-ray and electron beam radiation therapy. Internal form includes interstitial brachytherapy administered as low dose rate or high dose rate. Single treatment dose or fractionated dose over a period of time is recommended. Pulse dye laser. It's a non-ablative therapy that targets keloid microvasculature to improve scar appearance. Wavelength ranges from 585 nanometers to 600 nanometers. It specifically targets hemoglobin and oxyhemoglobin as they are chromophores. It causes microvascular damage that results in local hypoxia and decreased nutrient supply. This serves as a catalyst for several biochemical changes within the scar, ultimately leading to decreased levels of transforming growth factor beta expression, decreased fibroblast proliferation, and increased fibroblast apoptosis. Pulse dyed laser is used in 12 to 18 sessions with 4 to 8 weeks between these sessions. Ablative lasers. Carbon dioxide and erbium YAG lasers can be used to either superficially ablate keloid or surgically excise keloid scars. They target the water molecule, causing local tissue changes, which include collagen remodeling, increased levels of basic fibroblast growth factors, and decreased levels of transforming growth factor beta. 6 to 12 treatment sessions are recommended. Laser-assisted drug delivery. Laser increases the drug penetration beyond the stratum corneum. It is applied to create cylindrically shaped microablation zones into the skin that allow for topical agents to reach the dermis. Lasers are used with corticosteroids, 5-FU, and imiquimod. Erbium lag lasers can be used every other week with twice daily application of topical betamethasone cream. A total of 4 sessions with 6-week intervals is recommended. Platelet-rich plasma is a concentrated autologous plasma which contains high platelet levels and growth factors like transforming growth factor, vascular endothelial growth factor, and platelet-derived growth factor. After surgical excision, PRP can be injected into the wound bed for enhanced healing. So to summarize, keloid is an excessive pathological scar seen on the skin. It is a scar tissue which is deposited within and beyond the boundaries of the wound. It results due to excessive proliferation of fibroblasts and increased extracellular matrix deposition. It results from overexpression of inflammatory mediators like the transforming growth factor beta. Clinically, keloid is pruritic, painful, and unbearable. There are various techniques to manage keloid, ranging from occlusal therapy, compressive therapy, intralesional steroids, surgical exclusion, multiple topical application agents, laser therapy, and platelet-rich plasma. You can find the link to MCQs for the topic in the description of the video. We hope you liked the video, and if you did, please subscribe to the channel for more videos and hit the notification bell for update on new videos.